Bismillahirrahmanirrahim. Hello friends, today we will discuss about the pneumonia. Today's lecture's outline is introduction, sign and symptoms, etiology, diagnosis, complications, treatment, general management of pneumonia. What is pneumonia? Pneumonia is a inflammation of alveoli in the lungs. Pneumonia is infections in one or both of the lungs characterized primarily by inflammation of alveoli in the lungs. Alveoli are the microscopic sacs in the lungs that absorb oxygen. Types of pneumonia. Pneumonia affects your lung in two ways. According to area involved, we have LOBAR's pneumonia and bronchial pneumonia. LOBAR's pneumonia affects a section or lobe of the lung. Bronchial pneumonia, also known as bronchopneumonia, affect patches throughout the both lungs. As you can see the picture showing that in the in the left lungs there is a pneumonia. Only one lobe of the lungs is affected. Signs and symptoms: high fever, shaking, chills, shortness of breath, increased breathing rate, chest pain when you breathe deeply or cough, dusky or purplish skin color, cyanosis from poorly oxygenated blood, fatigue and muscles ache, nausea, vomiting, diarrhea, cough, particularly cough productive of the sputums. Signs and symptoms: Streptococcus pneumonia. Rust-colored sputums appear if there is streptococcal pneumonia infections. Pseudomonas haemophilus pneumococcal species may produce green sputums. Klebsiella species pneumonia, red currant jelly sputums. Anaerobic infection produce foul smelling or bad testing sputums. Newborn and infants may not show any sign of the infections, or they may vomit, have a fever and cough, appear restless or tired and without energy, and or have difficulty breathing and eating. Older people who have pneumonia sometimes have sudden changes in their mental awareness. Etiology: what are the causes of pneumonia? Bacteria. Bacteria are Streptococcus pneumonia, Legionella pneumonia, Chlamydophila pneumonia, Staphylococcus aureus, Streptococcus pyogenes, Neisseria meningitis, Klebsiella pneumonia, and Haemophilus influenza, pneumocystic gyrosi. Viruses which causes the pneumonia are influenza virus, adenovirus, rhinovirus. Mycoplasmas, they are not classified as to whether they are bacteria or viruses, but they have traits of both and they cause pneumonia as well. Other infection agents such as fungi, pneumocystic carinae, various chemicals which are causing pneumonia. Who gets pneumonia? The person who smokes cigarettes, recent viral respiratory infections like a cold, laryngitis, influenza, difficulty swallowing due to stroke, dementia, Parkinson's disease, or other neurological conditions, chronic lung disease such as COPD, bronchitis, and cystic fibrosis, other serious illness such as heart disease, liver cirrhosis, or diabetes, living in a nursing facilities, impaired consciousness, loss of brain function due to dementia, strokes, or other neurological patients can get pneumonia. Diagnosis: how we diagnose the pneumonia? We diagnose by helping of chest x-rays, blood test, sputum test. As we discussed that if there is a bacterial due to the pneumonia caused by bacteria, so sputum's color varies with the strength of the bacteria. So sputum test also diagnose the pneumonia. Bronchos bronchoscopy, pulse oximetry. Complications: bacteria in the bloodstreams. If we do not treat the pneumonia, so pneumonias may complicate uh, and get worsened by the bacteria come into the bloodstreams, which causes bacteremia, lung abscess, build up of fluid in the space between lung and chest wall, pleural effusions, difficulty in breathing, shock and respiratory failure, septic arthritis, endocarditis. Treatment. Most people can be treated at homes. If pneumonia becomes so severe that the treatment is in a hospital, you may receive fluid and antibiotic in your vein. Oxygen therapy and possible breathing treatments should be done. Viral pneumonia antiviral like oseltamivir and zenamivir are given to treat the viral pneumonias. Bacterial pneumonia patients with mild pneumonia who are otherwise healthy are treated with oral macrolides antibiotics such as azithromycin, clarithromycin, erythromycin. Patients with other serious illness such as heart disease, chronic obstructive pulmonary disease, or emphysema, kidney disease, or diabetes are often given more powerful or higher doses of antibiotics because the patient is of severe illness. They need treatment, more treatment. So there is a huge amount of bacteria. For huge amount of bacteria we need large doses of the antibiotics. Antibiotics which used for the bacterial pneumonia are penicillin. Common penicillin used to treat pneumonia are amoxicillin, amoxicillin clavonate, ampicillin, benzyl penicillin, piperacillin tazobactams combination, tecaracillin clavonate combinations. There is a risk of a type of jaundice if you take amoxicillin clavonate because it affects liver function, so the liver cannot functions well, so they causes jaundice. Macrolides often prescribed interferes with other medicines, stomach cramps, and can damage liver if taken for a long time. They are the adverse effect if the patients of the pneumonia takes macrolides for a long period of time. Common macrolides used are azithromycin, clarithromycin, erythromycin. Ceftaroline, a cephalosporin, is newly approved for the treatment against methicillin-resistant Staphylococcus aureus and multi-drug resistant Staphylococcus pneumonia. Fluoroquinolones are also um, used for the treatment of pneumonia, in which we use ciprofloxacin, levofloxacin, gemifloxacin. Side effects of fluoroquinolones include nervous system, mental and heart problems, sensitivity to lights. Pregnant women should not take these medications because they harm to the fetus. Management of the pneumonia. How to manage the pneumonia patients? We should give we should give suggestions to the patient to quit smoking, practice good hygiene, stay rest and fit, wear surgical mask by a sick and maybe prevent illness. Appropriately treating underlying illness such as HIV, AIDS, diabetes, mellitus, and malnutrition can decrease the risk of pneumonia. Get a pneumonia vaccination. Vaccinations, which are used for to prevent the pneumonal infections. Pneumococcal conjugate vaccines Prevnar for children less than 2 years of the age or between 2 and 4 years with a certain medical conditions. They can take the pneumococcal conjugate vaccines. Pneumococcal polysaccharide vaccines, Pneumovax. Other name of this is Pneumovax, which are used by the adults who are at increased risk of develop pneumococcal pneumonia, such as elderly, diabetes, those with chronic heart, lungs, and kidney diseases, alcoholics, smokers, and those without a spleen.